Hello and welcome to the Functionally Enlightened podcast with Dr. Sharon Sarita. We interview well-respected medical and functional practitioners, as well as patients who have overcome disabling chronic conditions, such as dysautonomia, and reclaimed their health. These enlightened guests provide helpful tips on managing chronic pain and illnesses, using a combination of traditional and whole-body healing modalities. If you're interested in natural healing and quality of life improvement, you're in the right place. Thank you for listening to today's episode.
Hello and welcome to today's episode. Today I'm honored to have special guest Dillon Welliver, who's a seasoned psychotherapist with over 15 years of experience. He's worked in a variety of settings with both adults and adolescents, specializing in treating grief and loss, co-parenting, existential issues, depression, anxiety, addictions, and trauma. His aim is to guide people through exploration of past and present circumstances and negative messages received throughout an individual's life, both internally and externally, with a focus on bridging the gap between one's authentic and beautiful self and the current state of distress. His methods align with the concepts of functional health as he takes an individualized approach to counseling, allowing the direction to flow organically in order to uncover the hidden culprits, be they thoughts, emotions, or self-defeating behaviors. So thank you, Mr. Welliver, for joining us on today's show.
Yeah, quite wonderful to be here.
So if you wouldn't mind, could you please share with our audience some of your background, your expertise, and the things that brought you into the current field?
Yeah, like all of us, my career has been sort of varied, sort of organically moved from sort of one thing to the next. I got my master's in clinical psychology 2005, incidentally where I also met my wife, who is also a licensed mental health counselor in grad school. I was always, beginning, particularly in grad school, I really was interested in existential therapy. I was in my own journey at the time, and still am, but I was very interested in sort of what are we doing here, meaning making, storytelling, narratives. I do a lot of that in my practice, sort of pull at narrative threads, looking for faulty beliefs and corrupt script. I spent some time working in residential centers for addictions. I spent almost 9 years work as a contractor with the Army, working with soldiers and families overseas in Germany. About 2018, started this practice, and my wife and I moved to Tallahassee here in 2019. And really, I see a lot of veterans now, and my primary focus over the past 5 years really has been trauma, really understanding and treating trauma. So that would be my primary interest at the moment.
Would that include physical trauma as well, or emotional, mental?
All types of trauma. Trauma is trauma in a lot of ways. That's why about half my caseload are veterans here. I'm a community provider with the VA.
You mentioned very diverse background, but what are the kinds of things that stood out while you were training or within your practical experience that you make sure embedded into your practice now?
I think at the base of all human neurosis is a variety or varying message, or the same message that there's something wrong with me, that there's a problem with me. I think that it's at the center, it's at the core. It starts at early attachment issues. And so, in the beginning, I wasn't able to quite articulate it in the same way I can, but I think early experiences, traumatic experiences, and trauma can occur even in the womb, or, a lot of our trauma is 0 to 2 age, where we're sort of absorbing the messages of the world, pre-verbal, pre-memory even, where these programs of the world that tell us things about us, or they're gifts from our family members, our friends, our cultures, our teachers, our ministers, give us a bunch of false narratives about ourselves. And so that's something I think that's been central to my understanding of how I really approach my practice and the work with my clients. I think that answers the question. I'm not sure.
Yes, that's very interesting. And you mentioned the age range of 0 to 2 being a prominent one. Can you elaborate a little more on that?
We're born, a baby, an infant is just as conscious as an adult. They just don't have languaging. They don't have conception of what they're experiencing, but there is consciousness, the same awareness as an adult. And, a lot of times, even loving, happy families, trauma can happen in the crib. How to start with this. There's so much to talk about in this space. I had a therapist once when I was talking about my life. It's a long time ago, and I told him, I never really had any traumatic experiences. And he's like, hold on, let me stop you there. Were you ever in the crib where you were crying, and maybe it took your mom 4 minutes to get out of bed, but as a little infant, you were terrorized? you were confused, you were left alone. Those little moments, they don't go away just because we forget them. They kind of stay with us. And so, early childhood, 0 to 7 really is the time. You might have heard them say 7 is the age of reason, like age 7. The brain changes at around age 7. But prior to that, it's in a very hypnotic state. The brain is absorbing the programs of the world, and so we're in the atmosphere of our parents. Generally, that's the primary programmers in the early stages. And, mom is stressed because postpartum depression, or there's financial worry, or there's lack of sleep because kids never let your parents sleep. And so we just kind of absorb a lot of stuff pre-memory. So that's what I talk about at age 0 to 2. And they even believe, whoever they are, researchers, that a lot of personality disorders really start at that 0 to 2 age. Even Erik Erikson, the stages of development, the 0 to 2 is trust versus mistrust. Can I trust the world? Can I not trust the world? That's kind of the first crisis to resolve. It's pre-memory. So yeah, I could go on, but
yeah, a lot of our listeners are actually they're chronic illness patients. Like they've dealt with their own stressors physically and emotionally, but they're parents of the chronically ill. So
Right.
Can you talk about the differences between how a chronically ill person would handle their own stress versus them handling the stress of, family or friends?
Yeah, that's a good question. And so there's a lot of factors. There are genetic factors involved in this, and it depends on what the chronic illness is. But I would imagine, and this is just me speaking, necessarily not the truth, but their nervous system absorbed the atmosphere, the texture, the tone, the energy of their parents, just being around them in this chronic illness all the time. Our nervous systems, they kind of match what's around us. They kind of become have you ever heard your mom come out of your mouth, or your dad in your head? Probably early on, there was messages of sickness, unwellness, chronic pain that were, again, pre-verbal, even into this age when they kind of could speak and talk to mom and dad. I dipped my toes out of psychology here and there in my practice, but I like to believe that our chronic physical illnesses, they start in the subtle, they start in the emotional, they start in the cognitive, they start in the subtle layers. And if we don't resolve those in the subtle, they move into the gross, the physical. And again, this is not the case all the time. And, again, small t truths, but I think, chronic illness, to be controversial, can be kind of a learned behavior from the nervous system.
Right. And I've recently done a lot of work with doing mindfulness practices. I'm not sure if you've heard of like the Gupta program or
Sure.
NRS. And then there's something recently that I've started incorporating, and it's called Brain Tap app. Have you heard of that one?
Brain Tap app. Honestly, there are dozens and dozens of really good mindfulness and mixing mindfulness and cutting edge neuro understanding of the body, and so they're coming out all the time now. And I think pretty much anything is good as long as it feels good, gets results. Right. One of the therapies I do is emotional freedom techniques, and it's a form of tapping on acupoints. But there are lots of things. There's lots of new and exciting energy work that is kind of coming into the zeitgeist now.
And you said something that's very key. As long as it feels good to the person. There's some people, myself included, that I tried to practice meditation, and I just would not be able to maintain the focus for more than a couple minutes. Yeah. So I didn't feel the benefit of that. Yeah. I guess, how would you be able to determine what types of applications would be best for clients?
I've kind of learned to trust my intuition. And so, I'm working with a client, I'm kind of asking the question, I'm looking for what can this client contain? Like what's their worldview? What type of intervention is going to work for them? What wouldn't work for someone else? And so some people, the head may be too loud. Too much talk in the head, unquiet, to start something like a kind of a standard mindfulness meditation where there's not a lot of instruction, just sort of be quiet, go inward. So I think a lot of times there's various types of guided meditations, whether they go into the body, where you go way out in space, where there's walking on a beach. They're so varied now. Every day there's another good one coming out. And so, really it's a case by case basis. But what I would say is what I do tell people when they first start to meditate and they say, it doesn't work for me. And I say, you got to give it time, because a lot of times what happens when we first go to start being quiet, like the body quiet, mind quiet, the mind gets louder. And I realize I've been moving so much so that I can stay just a step ahead of this chatter in the head. And then if you sit still, the chatter catches up. So I practice a variety of meditations, techniques that I've learned that I've incorporated, I've made up on my own. But a lot of it is like, well, you got to wait it out. And so if it's uncomfortable for a little bit, that's okay. Because when we move inward into the body, there's a signaling to the nervous system. If we could stay with it, that there's not a problem. If I move inward, I'm paying attention to the heart rate, to the breath, paying attention to the various aspects of the body. The nervous system, which would really, like, the risk of going too far off kilter, one of the things the nervous system does is it's looking for danger. It's looking outward. It's looking for that tiger. And if you go inward, in the beginning, it might get louder. There might be a lot of somatic activation, like the shoulders get tight. But if you stay with it long enough, it does generally tend to quiet down. And so it's like there's a barrier in the beginning meditation. There's like a little barrier of like almost repulsion. It repels the consciousness off that barrier. And you just got to pass through that. You got to wait it out. And if that means trying other types of meditations, there's no wrong way to do it. Really, it's just I have intention to get to know me, to get into the body, to get into the heart. And I keep paying attention to that intention. It'll happen eventually. It just will.
So even if a client or a patient is dealing with stumbling blocks to the meditation, you either recommend they try something else, or like, when is the stopping point for them to keep trying the same practice? Like, how do they know when to move on?
Yeah. So in practicality, what I do with them is I try different things with them. And so we'll try some tapping. We'll try a number of different meditations that I've developed, and I'll kind of see what lands, right? And so if I see what sticks, we'll do more of that. Another thing that I really believe is that each person has an inner guidance system that knows what's best for them. And I don't know what's best for them, but the inner guidance system does. And the inner guidance system, it sits below all of the corrupt messages of the world. And it's just very quiet. And so I'm always encouraging clients to make their own decisions. Like, if this doesn't work, try something else. Go explore. Do some research. Here's some research. But if something really doesn't work, this is actually its own practice in itself. We kind of get in the heart and say, does this feel right? What does the body say? Does it feel right? Does it feel like not right? And so kind of empowering people to pick up their own intuitive voice versus hearing it from a professional who, quote unquote, knows more than them.
What you're discussing now reminds me of the book, The Body Keeps the Score.
Yeah, absolutely. Yeah.
I'm doing a lot of work with inner parts too, not on a professional, but on a personal level. There's craniosacral therapy, and they combine that. They've been combining that with a few of the practices that you mentioned. Do you refer out to other holistic practices, or do you combine things to make sort of a protocol for your clients?
I do a lot of referring out. A lot of my teachers over the years have been authors and people that aren't necessarily taking clients. But I refer out to a lot of the masters I've come across. My method is not very systematic in the sense of like, I kind of sit down and I systematically from the left brain come up with a strategic treatment plan. I do some of that, but much more of an intuitive, go kind of what feels good each meeting. Pretty clearly, like I can tell like this client's not a fit for me. They're not buying what I'm selling. And in that case, I'll refer out. I have a lot of referral options in Tallahassee and beyond.
Going back to physical treatments, you're working with your clients and you do various techniques. Do you give them resources that they continue these things at home? Are they able to learn these things or be able to self-treat?
Yeah. So that's the whole idea is, I don't believe that if you don't do anything in between the times that we meet, then nothing's really going to happen. You're expecting all the healing to take place in the hour of the session. And so everything that I try to teach, I encourage people to practice, whatever it might be, whatever visualizations, guided meditations, emotional freedom techniques, tapping on acupoints, somatic experiencing. I'm learning a new method called selective inhibition, very fascinating way to kind of activate nervous system responses to resolve trauma somatically. Another whole conversation. So, but absolutely, I really encourage clients to, again, if you have intention and you're clear on your intention, I want to heal, I want this thing, get clear on it. But if you don't pay attention to it, then it won't happen. But if you keep coming back with your attention point, attention with an A, and you're sort of steadfast and you have a sense of discipline and practice around it, whatever it might be, my belief is you'll find it. It will unravel at some point, not without challenges, not without roadblocks, but you keep coming back to it and you kind of stay from the heart, and an intention is heart-centered, it will unfold.
So in dealing with the nervous system, and people in my realm, they suffer from a condition known as POTS, postural orthostatic tachycardia syndrome. And with that, a slew of other symptoms that can be quite debilitating. Many cases, people are pretty much homebound. They have to leave their work. It's pretty much a 180 if it's a new diagnosis, a 180 from their previous life. And I'm one of those specific cases where I was an environmental engineer doing field work. I had a surgery, and then just like that, everything was switched off. The nervous system was malfunctioning every way it could. So how would you address these types of situations where it's not something that's like slowly developed, but more of a cascade of symptoms?
So in that case, what I would do is, like to say, if this was a situation I was working with, is so I would approach it more of like, let's go on a journey together to discover how you're going to manage this. So we're going to always, particularly when I come see someone with like a chronic illness or chronic pain, first thing we look at is, are you going to orthopedic? Are you going to a neurologist? Do you have physical therapy? Are you following everything you can get? Are you going to acupuncture? Are you getting massages? And so we kind of would check some of those boxes off first. Then we'd look at, what's your diet, sleep, and exercise, the triad of health. I'll do all of those things to the extent you can do it. Are you doing it? Those are low-hanging fruit, but surprisingly enough, not a lot of people are doing all that. Whether it's having healthy sleep hygiene, really noticing and paying attention to and improving diet, and moving in any way that can without causing more harm. So I would start there. We would practice with some of the somatic experiencing. I would practice with some of getting into the body, getting into really just kind of getting in touch with the nervous system. It's just so varied, hard to say. There's this idea that what we resist persists. And so in a lot of ways, if there's a chronic illness and I'm really in resistance to it, I don't want this thing. I don't want it. And that makes sense. It hurts. In this case, it really, really disrupted your life in obviously a variety of ways. And so there's some level of particularly with chronic pain, of kind of coming to accept, not like, and less resistance to this thing. And again, we're not making these wild predictions that everything can just kind of magically go away. So to kind of get back to your question, it would be more of like a collaborative journey of discovery of what works best for you. How can you hold your intention on, on what's reasonable, and to keep paying attention and keep working the angles, whether it's medical, whether it's non-traditional.
I love that you brought up, what you resist persists, because in initial stages for anyone, or, accident victims or anything like that, you want to fight it and you want to make the assumption that everything's going to go back to normal. Mm-hmm. But it's not really the case. Everything is a learning experience anyways, whether we do recover physically or not, but things change. Going off of that, if you try to resist the change, it's going to make everything entirely more difficult.
Yeah. Obviously, there's a grief process when it comes to this. Grieving the old life, the whole stages of grief. Whoever came up with that was pretty smart, because, the shock, anger, bargaining, denial, acceptance, or depression, acceptance, and so there's all of that to move through. And it could take, and this number keeps coming up, 2 years to healthily move through a major loss, to kind of get to a space of acceptance, which doesn't mean I like it. I'm never going to like it. That would be dishonest, right? But I can accept it in the same way I accept that it's raining. I'd rather it not be raining. I had plans, but I'm not really in resistance to the rain.
When you say about 2 years, that's assuming somebody is accepting, going through that phase of it. But for the people who are, with chronic physical pain or some illness, that they're seeking medical help and visiting various specialists, do you think that those clients would have a hard time moving through those stages of grief?
Oh, yeah, absolutely. And it all depends upon our history, our worldview, how much trauma is being stored in the nervous system. I think 2 years is well, don't hold on to that number too tight. Really what it's saying is even from a healthy, balanced, well-attached nervous system, a major loss, whether it's a loss of a person, a spouse, partner, or something like your situation, it's going to take time to move through the anger, the denial, the depression, the reality of the loss, to change your systems, your daily systems. It takes time. And so people can get bound up in any of these stages, go into resentment and anger and depression and hopelessness, and really kind of pause the process, we'll say. for long periods of time. People can grieve for decades. It's not linear. So you could be in multiple of these stages simultaneously. You can be acceptance one day, back to anger the next day. So it's really not a linear process.
So for some of our listeners, they've been told they're having, I don't even know if this is terminology, so you can correct me, they're having psychosomatic episodes. And then there's an argument that no, it's physiological.
Yeah, chicken and egg. I think a lot of people that I've worked with that have a legitimate medical diagnosis, but it's one of those ones, it's just kind of hard to point, like fibromyalgia. It's hard to get the diagnosis. And so they hear this from an overtaxed, overworked, broken medical system. Oh, it's all in your head. It's just stress over and over again. And so I'm always careful to be like, just to label it as psychosomatic. I say uncover every rock you can. There are legitimate chronic genetic physical problems that can't be explained away psychosomatic. But I imagine a lot of people hear that a lot from doctors. And it's very invalidating. The whole field of research about medical trauma, just being in the medical system, being routed through the medical system, it's itself its own traumatic experience, not being listened to by doctors.
And you touched upon something that we incorporate too in diet, rest, exercise. I think you said it.
Triad of health. So sleep, diet, exercise is a military term, actually. Yeah, they were pushing that really in the Army when I was working there.
We work with that as well. Diet, rest, exercise, and then stress reduction is critical. So stress being external and internal. External and internal stressors. So when I'm working with people, we look at things basically from nutrition aspect, the rest, which includes the mindfulness and unplugging from your day-to-day grind.
Screen addictions we all have.
Yes. Yes, absolutely. And I have two children. One of them he's a teenager now. So I know it's really hard to break him from the screen. And that's not something I had to deal with when I was a child or my parents had to deal with.
We just had TV, ATV, ATV
with a few channels. But so that would be part of stress reduction too, just unplugging from all of these technological gadgets and social media. And what are some other things that you see are hidden stressors to the commoner? Like they don't make that association that this could be something that's impacting me negatively.
Yeah. The other big piece of this is relationship. In my words, there's the triad of health, which is sleep, diet, exercise. And any healer that doesn't address these three things, on top of how do I kind of disconnect from anything unhealthy addictions, we'll say. The next layer is relationship. So looking at relationships at work, looking at relationships with family, relationships in the house, in a lot of ways, cutting out relationships that don't serve you and moving towards relationships that nurture somebody. And I think that middle upper pyramid of, if you've heard Maslow's hierarchy of needs, is like, who am I in a relationship? Well, relationships are probably the number one stressor of human beings. Period. A teacher that said relationships the hardest game on the planet.
Those that are closest to you are the ones that hurt you the most.
Because they're the safest.
We talked about some of the practices. Do you have any ones that are your favorites that you were feeling like you want to delve into a little bit more, learn more, maybe make it more exclusive?
Yeah, I am currently in a training program for psychedelic, somatic, interactional psychotherapy, PSIP. And so it's using cannabis, ketamine, other psychedelics, nothing, right now, Florida, the only one with legal be cannabis and ketamine, but to, low dose trauma work. It's really kind of a fascinating new idea. There's models of like ketamine assisted or psychedelic assisted therapy where someone does kind of high dose and the therapist is kind of a sitter, just kind of watches, helps encourage. But this is a very like directive approach about drawing, while on the medicine, drawing the attention into the somatic channels and recognizing all the little myriad things we do to alleviate anxiety, stress, usually like body movement, swallowing, wiggling, fidgeting, and learning to resist that, not do those things. And what happens is the body's autonomic processes start to take over in time. This is a longer conversation to really talk about this therapy, but the body begins to resequence trauma. It resequences event memory. A memory that's, whether it's declarative, I can speak it, this is what happened, or non-declarative, as in, I don't remember this thing happening, but it's in the nervous system. And the really fascinating part about this is this kind of therapy with the psychedelic can actually access those pre-verbal memory, like someone who's born like addicted to heroin or adopted or in the NICU for 6 months period of like time where it can get back to those moments of dissociation and begin to resequence that in a somatic level. It's really kind of fascinating. It's a whole other conversation. conversation. That's what I want to do kind of moving forward, is incorporate that into my practice as well.
Very cool. And for some of our listeners who might not know what ketamine is, can you briefly say what it is?
Most people that I bring up ketamine have said, oh yeah, I heard an article about that, or I saw a documentary about that. So it's getting more into the zeitgeist. But ketamine, it's a sedative. It's been used by anesthesiologists for probably a century or more for surgeries. And I think they even still use it with kids some. But it's also a street drug called Special K that people would take and have psychedelic. It has psychedelic and dissociative properties. And so they've been actually able to legitimately study it, and it's kind of being billed as used for treatment-resistant anxiety, depression, trauma, chronic pain even. And so there's all these clinics that are popping up all over where people can go and get a ketamine infusion. Typically, it's like a 6 ketamine infusion over a course of 2 weeks that, long story, is supposed to kind of increase the ketamites in the brain, which is a glutamate molecule, which glutamate neurotransmitter is in learning. So if you learn to ride a bike, their nervous system, it's glutamate as opposed to dopamine, serotonin. And so it's also used that way, but it's a psychedelic in the sense of like when used in the methodology I'm talking about, it moves into what's called second primary mind consciousness, like the consciousness that we share with mammals and other psychedelics do this as well, cannabis and psilocybin and MDMA, and can reactivate a natural nervous system healing response. And so like animals, you have a gazelle that gets caught by a lion and gets away. It doesn't walk around traumatized and dissociated. It has a system, it's called autonomic nervous system resolution, that actually moves it back to 0 point, calm, relaxed. But what happens is in humans, we resist that. We don't want those things to happen. We don't want the anxiety, and so we resist it. So the adage, body keeps the score, but the mind erases the score. And so this therapy, the psychedelics, can begin to quiet the kind of secondary mind, the human mind, so that the primary mind can actually do what it's been designed to do, or what it's been evolved to do over millions of years, is resolve internal trauma. And so this is kind of a fascinating new segment of study right now. So that was a long-winded answer to your question.
Very intriguing. I'd love to learn more about that also. And you mentioned the clients do typically the infusions, 6 to 8 infusions. Is it something that's long-lived and they have to return?
Yeah. So the research is still out on that. So typically it's like a nurse anesthetist or a psychiatrist or someone who's like licensed to stick a needle in an arm, and it's in a comfortable chair. There's nurses. So it's a clinical setting, and there's different protocols, but it seems to be the main protocol is 6 infusions within a 2-week period, followed by maybe 2 weeks later, you do another one, and then maybe like another month, and then maintenance doses that may occur every 3 months, every 6 months, every once a year. They're still working out the best practices with this. But the benefit of ketamine is it's far less harmful than most of our other depression medications, SSRIs and antipsychotics, all those stuff. It's just, it doesn't have the same negative side effects. In fact, ketamine is pretty short half-life. Doesn't have, as far as we're knowing now, a lot of negative side effects. So it's not something you do every day like you would take like a Prozac, which, a lot of research has basically been saying Prozac works about 50% of the time. No better than a placebo, really. The SSRIs. Yeah.
And then you have all the side effects that you deal with. So with clients that you've worked with that have done any of these psychedelic treatments, do you notice that they're experiencing side effects that are putting them off? Or
not really.
They feel positive?
No. And there's a particular clinic that I work with here. It's called Novel Mind and Wellness, which I really trust the director there. That's where I send most of my clients that are interested in ketamine. I send them there. And so, no, most of the clients, they're like, I'll hear things like, especially my traumatized vets, they'll say, I think I'm ready for another ketamine treatment. The sludge is starting to come back, and they'll go to the treatment and they'll say 2-3 days later, yeah, the sludge is gone. There's just a background layer of anxiety that's not there that was there before. But, there's no magic bullet. It's important to say that piece. There is no real magic bullet. This is the answer. This is going to work. Here's the magic chalice, right? But it's promising. Ketamine is promising.
Right. And in combination with the other strategies, I'm sure that, most clients are going to see improvement.
Yep. Mm-hmm. So it's expensive though. Yeah. So, yeah.
Oh, yeah. Because they don't need to be confined to a diagnosis code or trying to run through insurance. So that's the beauty of it. Like the bio-individual approach that functional health and even your practice is able to do, because you're looking at each individual, what works for them. And you know, you can work through your lists of things. If this doesn't work, you have other options.
And I particularly don't like diagnosing. I will do it if insurance requires it, but it's not, that's why I've never liked the term PTSD. We all have trauma. They just drew a line and said, at this point, now we call it PTSD. Prior to this point in the symptoms, it's not trauma. Even the name is terrible. So
yeah.
Yeah.
Are there any things that you recommend to your chronically ill patients? Maybe those have been dealing with symptoms, whatever symptoms they have, for more than a couple years.
Anyone who's willing to go there with me, the most important thing, and I'll steal from Ram Dass here, this is not me, the most important thing we can do, period, is nurture our interconnection to whatever you define to be higher power, whatever that might be. But it's in the heart, it's on the inside. I believe that every ailment that we are experiencing was created by us, for the purpose of our soul's growth, whether we get healed or not. And so if we can really kind of get with this idea of go inside, there's a space in the heart that knows everything. It doesn't speak in English. It doesn't speak in words. But there's a sense of knowing, and we just settle in with this space. I teach my particular form of mindfulness that I teach is playing in words. And so we'll pick a word like happy or calm or relaxed, and we'll just sort of put attention on this word. We'll pick a word like comfortable. And I said, just going to have an intention to be comfortable, and just notice the texture, the tone, the qualities of this intention of comfortable. Pay attention to this intention. And if we can sit there long enough, the nervous system begins to match that. The brain begins to rewire. And so I find myself really go into almost all my clients is playing in this word game. What word do I walk around in that I don't feel good? Whether it's frantic, whether it's hopeless, whether it's overwhelmed, and say, well, what word would be that opposite? What would be, what would you want to feel? I'd want to feel a sense of peace. I want to feel a sense of excitement. I want to feel a sense of hope. And so, okay, well, my practice is let's simply, for no reason, with no arguments, well, there are arguments, we're going to leave them outside our sphere. There's reasons why I can't be happy right now, but we're going to learn to ignore that and simply be happy. In the same way, if I were to say, raise your hand in the air, and you do, and I say, how do you do that? I don't know. I just did it. Can you be happy? And sit with the attention on happy long enough for the sensations, the textures, the tones, the colors, the experiences to show up, and they will. And so that is the practice that I really am excited about, and I really like to teach. And so it expands from where? This idea of wordplay. Pick a word, make that your word for the day. Be the word. Don't think the word. Be the word. And the more we do that, it's like we're absorbing. It's like there's a vacuum created. And if I'm comfortable, and there's a download of comfortable, but not if I don't practice it, not if I don't have attention on my word like comfortable. And so that is something that I think chronic ill, chronically happy, whatever it might be, that is something I always want to impart.
And that sounds like a beautiful practice. I don't think I've sat with one word, so I'm going to practice that on my own.
Yeah.
If there's people that want to work with you or learn more about your practice or the treatments you provide, how would they be able to reach out to you?
Sure. My website is blueskytherapeuticservices.com. If you just Google that, Tallahassee, it'll come up, and you can write me through the website. My wife does some work. She has another full-time job, but she does some work as well. That would be the easiest way. Blue Sky Therapeutic Services.
Fantastic. I'll make sure to include that in our show notes. And again, thank you so much, Dillon, for joining us today. It was very informative, and I'm sure our listeners are going to appreciate hearing what you had to say.
Thank you. This was fun.
Thank you, everyone, and we'll see you next time.
Dr. Sharon Sarita is not a medical professional and is not providing healthcare, medical, or nutritional therapy services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional issue. The information provided in this podcast is for the informational purposes only and is not intended to substitute professional medical advice, diagnosis, or treatment. Always seek advice from your physician or other qualified healthcare provider before undertaking a new health regimen. Do not disregard medical advice or delay seeking medical advice because of information you heard in this podcast. Do not start or stop any medications without speaking to your medical or mental health provider.